Welcome everyone to this morning to this exciting adventure as we shift from the community health assessment stage to the community health improvement stage with today's kickoff. Some housekeeping rules. So if you are online, please kindly mute your microphones at this point. And your ability to talk will not be taken away. If you're in person, please kindly mute your cell phone, silence your cell phones. And if you do need to take a call, please step outside. This meeting is going to be recorded and available at a later date online. If you're joining us online, please type into the chat box your name, role, organization, and your familiarity with community health planning, whether this is your first time or not your first time. If you have any questions, please raise your hand. Jackie will be watching the chat online in the Q&A box. I'll be watching you guys here in the room. And if I do start talking pretty fast, please raise your hand and slow me down because I have had a lot of caffeine this morning. Some interactive portions are going to be questions and also polls. So if you want to get ahead, please open up a tab on menti.com and enter the code 55633621 or note it down. That code again is 55633621 on menti.com, menti.com, and we'll be doing some interactive polling. Some of the abbreviations that we'll be using quite often are going to be Live Well Mohave or LVM, Community Health Needs Assessment or CHA, and the Community Health Improvement Plan or CHIP. And don't worry too much about capturing this code right now. A QR code will pop up appropriately. And if you do try to log in now, it'll just say that polling is coming up shortly as we kick off. So during today's meeting, we are going to do welcome and introductions. We are going to do officially kick things off, talk about visioning, talk about values that'll lead us through the Community Health Improvement Plan, highlight data findings from the community health assessment, which Anthony will share with us, talk about prioritizing all the different health needs and areas that were discovered during the assessment process, what we're going to do in terms of planning and next steps, and then finally closing remarks. So once again, I would like to officially welcome you to the CHIP Kickoff. This is a long, continuous process that happens every 3 to 5 years with a long-term strategic goal of being able to improve the health, safety, and wellness and quality of life of our Mohave County community. It is the CHIP and the CHA are both led by the Live Well Mohave initiative, and which was originally formed by the Mohave County Department of Public Health, represented here, as well as Kingman Regional Medical Center, also represented here. But Live Well Mohave could not act alone. It is also made up of many different stakeholders, from law enforcement, faith-based organizations, charities, both profit and nonprofit. We have the courts, we have schools, we have colleges, we have many people that come together to try to improve the health and wellness of our community. And to kick things off today, I would like to welcome Dr. Julius Pearson. He is the Chief of Business and Development here at Kingman Regional Medical Center, who's going to say a few words to kick us off in the right direction.
Good morning.
Good morning.
We have it's such a pleasure to see each of you. You all are the backbone of our community. My name is Julius, as they said. I've been here 2 years. One thing that I've definitely noticed about Mohave, it's unique in the world, is how we pull together to make things work. And for that, I appreciate it, and we say thank you. We also want to recognize Dr. Santarelli and his team for the and we look forward to having a very informative day. And let's make some changes. Let's do some good work. Thank you and good morning.
Thank you, Julius. I think those are some inspiring words that we can take to heart and as we get going with today's meeting. So the first thing I want to discuss is community engagement. And community engagement is the heart of participating and having active change in community health. So particularly while you sit here, as you listen to this presentation, sometimes as you start to zone out, as we present to you all of this data, I want you to think about how you and your organizations can start to build on the strength and resources within our community, how we can empower and share resources among all our different organizations as we begin to share and network more, what kind of research and action we can take for mutual benefit of our community members, and how we can promote co-learning and capacity building as we emphasize local relevance and ecological perspective. You know, community is a huge part of our identities. It's where we live, work, play, age. So we want to make sure that any changes that we enact are going to be lasting. We want to have continuous systematic development through cyclical and iterative processes. We want to be able to disseminate the findings both here today and as we go through the CHIP process to all of our community members and be able to involve as many people as possible and break down those silos. We want to have a long-term commitment to the partnership process. And a huge part of this is because public health is everywhere and involves all of us. Public health is an ecosystem. Pictured here on my right is the public health ecosystem and how the public health agency interacts with all of these different public health services and all of its different partners. This ranges from our schools to our neighborhood organizations or civic groups or nonprofits or nursing homes, community centers, home health, mental health, healthcare organizations, faith organizations, tribal health, corrections, elected officials, fire, transit, employers, doctors, hospitals, EMS, schools, and probably many other people that I haven't mentioned here, that all come together and want to be able to improve the state of our community. In a similar vein, this effort could not be taken on alone. I had to get lots of help and build a very strong team consisting of people that brought their expertise and brought their diverse backgrounds. So I'd like to thank Dr. John Ashurst, Clinical Assistant Professor, AZCOM, and Sarah Brady, Population Health Manager at Kingman Regional Medical Center, for bringing in their clinical backgrounds. To, of course, Melissa Palmer, Director, and Danielle Lagana, Special Programs Analyst at Public Health, and the rest of their team for really bringing in the history and background and expertise on public health and also doing the data collection in terms of both surveys and focus groups. Barrymore Controller and Candice McDaniel, who's sitting back there, calling you up, for keeping us on a timeline and making us accountable. I'm thankful for my team, Anthony Santarelli, our director, Jackie Neff, our grants administrator, sitting in the back and also managing the chat, and Tyrus Nelson, our data scientist, who did not want to take a picture, but is also a valuable member of our team for their dedication to data collection and data analysis. And also Alan Poston, who's sitting back there, VP of Public Relations, Adam Bernard, Manager of Marketing and Public Relations, as well as Chris Bennett, sitting next to Alan back there, and Julia Walters-Kowalska, for their dedication to getting all this information out there and making sure that everyone in the community knows how to participate, and also moving forward, what kind of programs will come out of it. So after the thank yous, the framework that the CHIP and the CHA is based off of is called Mobilizing for Action Through Planning and Partnership. If you've done community health planning before, you've probably heard of the MAP. This was developed by the National Association of County and City Health Officials, or NACHO, probably my favorite abbreviation, back in 2001, though it has since been updated last year. It's been streamlined a little bit more. So now the MAP 2.0 goal is to achieve health equity. And this is done through three major phases. Our first phase is to build the Community Health Improvement Plan Foundation. So as of today, where are we? The point of this phase is to start where you are. So figuring out what are our current resources, what strategies are we currently using, what has changed since the last cycle of the CHIP and the CHA. Okay? We also have the next phase to tell the community story. So to assess what is going on in the community. So using the qualitative research through focus groups, key informants, quantitative research through our community surveys, as well as secondary resources through state and federal data repositories, being able to assess where we are and also being able to tell the story of where we're going as well through priority planning and through implementation strategies. Phase 3 is to continuously improve the community. So coming up with those implementation strategies as well as data and evaluation monitoring for the future to make sure that any needs that were identified can have those priorities actually addressed for the next 3 to 5 years and the action is actually taken. Sorry, that was a lot of actuallys. MAP is based off of several foundational principles. The idea is that there is always continuous learning that allows for ever-evolving, adaptable, flexible responses to our ever-changing diverse communities based on a flexible framework. We want to make sure that as we're building these community partnerships, that they're going to be inclusive and foster a sense of belonging, that we want to build trusted relationships that honor the voices of people that bring their expertise and knowledge to the table, and we want to be able to empower the community to take action. Any action that is taken should be informed by actual qualitative and quantitative data, and it should be informed by the voice of the community. Next is building those strategic collaborations among various community partners and stakeholders, and being able to finally lead to full spectrum action through community building and leading to our ultimate goal of achieving health equity. To this end, the Live Well Mohave initiative in Mohave County is a broad community-based initiative that engages the public and community stakeholders in efforts to improve the health, safety, and quality of life of our Mohave County communities. Live Well Mohave has several goals for the CHA and CHIP process, namely being to build powerful community partnerships and to break down silos when it comes to healthcare needs and issues. We want to be able to maximize the resources that we already have, and we want to reduce the duplication of effort. We want to be able to empower the community to work together to improve public health, and then we want to follow best practice guidelines for health programs and strategic planning in local hospitals and public health departments. To break this down even further, within the CHA and the CHIP, the CHA provides the Live Well Mohave initiative, as well as many other Mohave County health divisions and other county departments and agencies, community-based organizations, and many other stakeholders with a comprehensive summary of leading health issues that are affecting our Mohave County residents. The goal of the CHIP is to provide these key priorities and strategies of what to address, particularly those social determinants of health, that will lead to improvements in health outcomes. And it basically lays out the plans of how this is going to be addressed in the next upcoming years based on actual community health needs as picked up by the CHA. So you have in the CHA outlining what the community is, and then the CHIP outlining how those things will be addressed. So I promised you guys some interactive portions. So get out your phones or get out your laptops. And you are going to open up menti.com. And we are going to do a little bit of health visioning. So health visioning will guide the CHIP process. And I'm going to go through 3 questions. And the first question is going to be, what does a healthy Mohave County mean to you? This can be a word, this can be a phrase, anything you want to add in there. People online can start to respond as well. It is open.
Need the code. I am more than happy to give it to everyone again.
Yeah, I recommend actually using the QR code. When I used the code, it opened me up to a later question.
A different one, yeah. So also say responding is off.
You're right, responding is off, sorry. Open responding. Can anyone tell me if it's working? Okay.
Oh, look at that.
Thank you.
See.
And if you do need any help in person, if you raise your hand, a member of my team is walking around and is very happy to help you. If you're having difficulty online, Jackie has put into the chat to go to menti.com and then the code.
Oh, I have to scan the thing again. Got to scan the thing again. Oh.
No, it should. So as we go through each additional question, it should just automatically advance you.
Got it? Huh? Well, you got something different than I do.
Yeah.
I'd say take another thing of it and try for it one more time.
Now, I'll just wait.
It says that I can't respond. Am I supposed to or not?
So if you scanned it before she opened up responses, then it's going to indicate that you can't respond. You'll have to rescan it after she's opened responses available.
Or I hit refresh a couple of times and eventually.
It is really cool. So you can do like polling, you can do like scales, you can do ranges, like there's a bunch of stuff. All right, thank you everyone for your responses. It looks like it's stabilizing a little bit. And it looks like we are centered around thriving. Who said thriving? Would you like to introduce yourself and elaborate a little bit more on the?
I never mind. I didn't say it. Yeah, Danielle Lagana, Public Health. I said thriving because there's that I feel like is the epitome of health.
Oh, thank you.
It also appears that a couple of different ways of phrasing equity for care. Has anyone indicated equity for care that they'd like to say a couple of elaborative words for? All right, that's perfectly fine. Well, thank you so much for your responses for that first health visioning exercise.
Oh, someone just got another one. Okay, I'm going to move on to the next one. So our next question is going to dig down a little bit, and we're going to talk about what are the important characteristics of a healthy community for all who live, work, and play and age here. Okay, and responding should be on for this. I'm seeing a lot of responses come in about resources and also support and access to care and access in general. All right. So who mentioned resources or access to care in their response? Bob, would you like to introduce yourself and elaborate?
I just said access, but access to care too. But I think if we have to go elsewhere to achieve the needs, then we're really not accomplishing what the community needs, to be broad-based.
Yeah, absolutely. Especially if we're sending them hundreds of miles, just try to find an organization that might help them, right? Becky, you had your hand raised?
Yeah, and I would say even within access is transportation to get to care or have care brought to you, if it's mobile units or whatever, that type of thing. And being able to get in a timely manner, you know, calling and getting an appointment 6 months from now when your foot hurts is not good.
Yeah.
So.
Yeah, we have difficulty with transportation in this area. There's very limited public transportation or not public transportation at all. And there's often very limited transportation getting from each of these areas, especially more outlying areas, into either Bullhead, Lake Havasu, or Kingman. And then also time to get into any given provider, right? So,
Well, and I think even more so, like the people in Chloride, Dolan Springs, so, you know, in those really rural communities, their access is so limited. We think we're rural here in Kingman, but we're not.
yes.
I think that we also have to realize that a lot of the people aren't aware of some of the resources that we do offer in this area.
That's true.
So educating people on the resources that we do have available is a big issue.
Yeah, that's a real need for either having like resource packets or just having meetings where people can come in and say like, hey, this is our resource fair for today. Here's everything you can access across Mohave County, right? All right, and then we'll move on to our third question of, well, what action can we take and what can we do together to improve community health? Yeah, I'll probably include like a screenshot of the word cloud in like the final PowerPoint that goes out to everyone.
I think that would be really nice, especially in the rural areas where a lot of these were brought up.
Yeah. All right, so it looks like to improve community health, a lot of these answers are centering around education and collaboration. Does anyone want to talk a little bit more about that? Did anyone answer these things? Yes, Candace.
Education, kind of to go off what Penny said with educating on what resources that we do have. But I also believe that we need to be educating on preventative as well. Like nutrition, proper exercise, things like that can prevent.
Yes, nutrition is a huge one. We'll see it pop up again in some of the data that Anthony presents. All right. Yes, you will. Of course.
In fact, now is a perfect time
to
take and open questions about the process before we move into the community health needs assessment methodology and data.
I did have a question about preventative care, because I feel that Kingman needs that more than anything, even just more than the nutrition. But doctors need to be practicing more preventative medicine here instead of waiting till you're in an emergency. I have noticed that. I'm from Chicago, so
Yeah.
they're huge on preventative before it gets to a heart attack or a stroke. I just wanted to know, is that something that Kingman, that KRMC is working on?
That's a great question. I'm going to punt it to Anthony.
Absolutely. From KRMC's perspective, we are approaching the health of our residents under a lifelong approach. So from preventative care, we start very, very early with what are called things like well child visits. That's when your kids are coming in to get their vaccinations, getting their checkups, and then you should be attending, ideally, an annual visit with a primary care provider. We do know it can be hard to get into your primary care, and that's really where you're going to interface with that healthcare staff for those long-term preventative measures, guidance to live your healthiest and best life. I might kick this over a little bit to Dr. Kano, who'd like to speak a little bit on primary care's preventative care.
To answer your question, yes. In our providers, including physicians, nurse practitioners, and physician assistants, we all try to have preventative care with our exams, well adult exams, and well child exams. The issues that we're running into now is, of course, access. We are booked out. We're trying to get more providers, and we're also trying to look outside the box to start programs, initiatives to make the resources that we have work more efficiently and better. So it is on our crosshairs, if you will. We are looking into it. We are trying to improve it every single day.
Thank you.
We recommend things like for preventative healthcare, we do have a wellness center here. It has cardiovascular rehab in it, but please go on a regular basis, right? Take those steps to prevent complications.
I'm a little remiss on the diet and exercise part. Does anyone have any questions? Or Jackie, did you notice any online? Not yet? Okay. So this concludes the health visioning part. So visioning and values are an essential part of the CHIP process. Just as important is the data that has been collected as part of the CHA. And I'm actually going to pass this off to Dr. Santarelli to talk about, since this is really his and Tyrus's realm.
Thank you, Tyrus. Thank you, Danny. Thank you, Jackie, for all of the work that you've put to putting together some of these data slides. Oh, I figured out if I can use this appropriately. So one of the important things whenever we do collect community health data, it's important to follow a set of prescribed methodology to ensure that the broadest spectrum of information can be collected. So really, when we determine the health status of our community, it starts with a planning and engagement process. We then move to collecting and analyzing and assessing that data for our residents' health needs. We work to synthesize that data and prioritize, which is what we're focused on doing here today. I'd love to show you all of the data collected for the community health needs assessment, but I'd keep you here for like 12 hours and then you'd all get bored, you'd yell at me, you'd want to leave, I'd get bored. But all of that synthesization and prioritization is meant to mobilize collective action. And the actions that we take will continue on this data collection process to both measure the implementation scope and then track the impact numbers that it has for the residents of our county. It worked. So for the community health needs assessment, we used a diverse array of data collection procedures using evidence-based, both qualitative and quantitative methods that tried to give voice to our residents, for health programming. So just in brief, the 4 primary data sources used in the community health needs assessment, which will be published early 2025, consisted of 1,473 community survey respondents. These were online and paper surveys. They were conducted from January 1st, 2024 to the end of April 2024. And these were about 70 to 75 question surveys. I promise you we won't go over each response. We then got the opportunity to sit down with 34 key informants to conduct a 30-minute to 60 minutes, some people are more verbose than others, semi-structured interview conducted in May. Danielle Lagana did a fantastic job running 7 community focus groups located throughout our major cities and our rural areas. Yeah, absolutely.
Question, what's a key informant?
Great question. I should have said it. So a key informant is a diverse group of individuals that exist in leadership positions from county to city governments, healthcare providers, and business owners within the region. They are kept anonymous as part of publishing this because their views, we don't want to inhibit them indicating their views, and we'll actually have a couple of quotes up here for what they indicated. And then we, of course, included hospital visit and discharge data from about 618,000 unique presentations into Kingman Regional Medical Center for the health needs and health concerns. So you see, as we move through this, we have community opinions and perceptions of leaders within the community, open roundtable discussions with residents, and then I will often refer to them as harder numbers for what people are actually interfacing with the medical system to get taken care of directly. So we'll walk through some of that data, and I'd like to start first with the results of some of the questions from our community surveys. Now, before we go into the direct results of those, it's important to align who responded to those surveys for how well they represent our population in Mohave County. So you're looking here at two primary demographics. Along the y-axis of your graph, you have percentages. That's the frequency of that respondent. And then along the x-axis, you're having different response elements or how they can refer to. So if you look onto the left side of the slide, under educational attainment, the colors here indicate in the darkest blue, the respondents of the Community Health Needs Assessment Survey, census demographics for Mohave County residents, and then census demographics for an Arizona population on whole, to try and put it into perspective on who is answering these. In general, the Community Health Needs Assessment respondents represent higher educational attainment than is kind of diverse across Mohave County, likely due to it being disseminated from public health groups, from the hospital, and some of the large groups coming in there. But we do see that the greatest number of responses have received some college through graduate and professional degrees. And when it comes to age, our community health needs assessment respondents are typically older than the general Mohave County population, with the greatest number of responses coming from individuals aged somewhere between 35 and 74 years old. When we look at their household income of individuals responding onto these survey, we're really happy to report that they mirror Mohave County's household income rates. You can see that those bars are relatively similar in there. And then the individuals typically live in a household of one or two other individuals. These are couples that are responding, or these are couples with a single child, or maybe a parent that they're providing care to. So one of the most important questions we asked on this health needs assessment are personal health challenges. These are challenges that the respondents deal with on a day-to-day basis, either with their own health or health of someone directly related to them. And the top three that we see across the county, in Mohave County, you'll notice that there's a slight breakdown here where we see Mohave County in our first bars, Kingman in our second or lightest kind of washed out blue color, Bullhead City, Havasu, and then our rural areas lumped into one group. We'd love to disaggregate that out by individual rural areas. And as we continue these community health improvement planning meetings, we will have that for you for that in that location. But the number of responses from some of them are a little low. We don't want to identify those respondents in a setting like this. So the most common, with about 13% of individuals indicating the highest personal health challenges, issues related to weight, overweight, obesity, issues related to aging, joint and back pain, and then of course high blood pressure. We see a general uptick in overweight and obesity for our residents throughout Kingman and Bullhead City, a little bit lower of concern in Havasu. But those are the top three reported personal health challenges for survey respondents. We can then move on to perceptions for community health needs when we ask our residents, and they diverge quite a bit from personally reported health challenges, with the most important perceived health need of the community is mental health services, with about 19 or some odd percent indicating that as a major need in the county. That doesn't map onto the personal health challenges, but it is here as a primary driver for perception throughout the community. Those are higher A higher rate of individuals throughout Kingman and Bullhead City report that as a need. Of course, a lower rate in Havasu and throughout our rural areas indicate that as a general need. Aging problems cropped up as number 2, with the highest rate of individuals reporting that as a community health problem existing in Havasu, that general area. And then a surprise to me and my team was motor vehicle accidents and crashes were the number 3 concern across the county. Though the Miner did just publish an article indicating that we seem to have a really high rate of that right now, and it seems like the community has picked up on that before. Well, at least the scientists in my office have managed to pick up on that. We then move into questions about social determinants of health. Is everyone here familiar with what a social determinant of health is? Yes, yes, yes. These are social factors, things like transportation, things like housing, things like economic security, poverty, that have long-term and lasting impacts onto the health and wellness of an individual. So these are our social barriers to becoming a healthier community. And the respondents of the survey indicate that the highest is endemic poverty, with about 14% of individuals seeing that as a major limitation to improving the health of the county, followed by a general lack of providers. We'll dive a little bit deeper into that here on to the next slides. And then a lack of affordable housing really skyrockets off in Havasu, with over 20% of individuals identifying that as a dire social need. We can zoom into a couple of other social determinants of health, one of which being food security. Once again, frequency of responses on your y-axis, location along your x-axis, and then the colors are different types of responses. So just to summarize in general, up at the top there, about 11.4% of respondents to this survey indicate struggling to procure enough food to feed themselves and their family on a monthly basis. So food appears to be a fairly dire social need. We're in a food desert. I think this doesn't come as a surprise to most of this audience. And then we also wanted to look at major transportation concerns. So this is the average distance individuals throughout the county, Kingman, Bullhead, Havasu, and our rural areas travel to receive health care. And 21.1% of respondents in total travel greater than 30 miles to interface with a health system. That's a bit too far, particularly for things like routine checkups, routine medical services. That's quite a bit of money whenever we're dealing with poverty as well. Click. So I said we'd dive a little bit more down into healthcare access, and we'll spend a little bit more time on these slides. I'll walk you through the graph. But survey respondents consistently report that healthcare is more difficult to access in Bullhead City and throughout rural areas in our county. That doesn't mean it's easy to access in Havasu or Kingman. And what we see here is these are the number of respondents who indicate that they lack an ease of access into different varieties of healthcare providers, with about 43% indicating a complete lack of access to specialist care. About 32% indicating a lack of access to mental health care, about 25% indicating a lack of easy access into primary care, 20% indicating a lack of access to dental care, 15% feel like they're unable to use an emergency department or urgent care facility. Now these numbers are higher in Bullhead and in our rural areas, which make a little bit more sense considering they're traveling a much longer distance to access these, but they are shockingly high even in our more urbanized areas throughout the county. So we wanted to dive in a little bit deeper, and I know there's a lot of words. I'll try and summarize it for you quickly. We then asked them, if you have difficulty accessing these services, why is that? Please inform us as to what those barriers are to getting in. So for specialist care, fairly uniformly throughout the county and our regions is that there's none in the area. And largely we do see that from the hospital perspective as well. It's difficult to recruit specialist physicians, and we often have to send services either up to Las Vegas, over to Flagstaff, down to Maricopa County. We have a very limited pool in the area. For mental health, our respondents feel uncomfortable using these services. There's still a preponderance of stigma against getting help for things like mental health or substance use. For primary care, The large driver is twofold. Either the providers are not accepting new patients, which I believe our providers are always willing to accept as many patients as they can, and they're scheduling conflicts. It's taking too long to get that scheduled out. Some of these may be for routine health maintenance that we are looking into ways to facilitate a more rapid visit for that. But as it stands right now, not enough coverage and scheduling conflicts are a bit too pronounced. For dental care, it comes down to a factor of cost. It's too expensive to afford, or the dentists in the area aren't accepting our residents' insurance. For emergency care, individuals without our county feel uncomfortable going to the emergency department. We didn't ask them what they meant by uncomfortable, so we can speculate all day long, but it's not a place that is, but from the perspective of a respondent, it's not a place that is welcoming, opening, or desired to go to. And then of urgent care, it's insurance, can't afford to visit, things along those lines. Does anyone have any questions in regard to the health survey, other information that they'd like to hear that maybe wasn't included up on screen? I'm assuming some of these people have taken, some of our attendees today have taken the survey, so they know how much longer it was. Anything? No? Fantastic. All right, so let's talk a little bit about what the key informants said. So these were 34 individuals throughout business leaders, healthcare leaders, and governmental leaders throughout the county. And we asked them a set of standardized questions addressing defining a healthy community, much like the visioning exercises that we did here today, what they identify as the most important health issues, what they identify as social determinants and barriers to health, who they believe are the most vulnerable groups throughout Mohave County, and then how they can see themselves and their organization addressing these issues. So when we're defining a healthy community, I think one key informant said it best, and I quote, "It's a society really that has all their well-being taken care of. Their mind, body, soul, and spirit, everything is well taken care of." And we see that in the relative frequency of responses. So Jackie did a wonderful job collating the diverse way of getting around these to systematize them into set end sections. So opportunities for active and healthy living, about 11% of our respondents indicate that as a driving need, that community feeling comfortable and safe, and that there be robust safety net and social services available to the residents of Mohave County. We then see a drop-off for equity and inclusive access moving down through there. We asked our key informants what they believe the top 3 health issues in Mohave County are. And to quote a key informant again, try to be more proactive in recruiting and retaining providers that you have here. Perhaps invest a little bit of money into the community so that it does become more of a desirable place for providers and people alike. Now, this is a response on 2 arms. And we see that across all of our key informant interviews, with community infrastructure, design, and resources being a major driver to improve health issues in the community, and access to healthcare being a driver, as well as education. For our social determinants of health, we're seeing from our key informants or business leaders, they'd like to drive in more resources to develop economic stability for our residents, improve the neighborhood and physical environment, and then improve the healthcare system. As one key informant put it, I think that a lot of people deal with it I think that a lot of people that I deal with, it is just the continuation of going around in circles. You know, they might get employment, yet they're still lacking affordable housing, and how long is that going to last if they can't pay rent? If they can't pay rent, then they probably don't eat. Really indicating this vicious cycle that some of our residents find themselves in due to economic instability, insecurity, homelessness, joblessness, and a lack of access to these supportive systems like healthcare, social services, anything along that line. And then when we talk about the barriers with our key informants, as one key informant put it, I feel like Kingman area has grown so much in the last couple of years, and it's hard to sustain that growth. Largely, about 23% of our respondents think that the major barrier to move out of the way is infrastructure, community design, and more resources becoming available to enhance that healthcare system, and then a diverse range of other responses that didn't neatly bin into some of these other elements. Our vulnerable populations, as our key informants kind of indicate, seniors, about 30.5% of the KIs believe that they're our most vulnerable population, followed by youth and teens, and followed by those who are economically depressed, lacking a source of income, people like homeless, children and infants, and low-income and poor individuals. You know, as one key informant put it, I think that seniors, children, and people with serious illnesses are the most vulnerable because we don't have the specialists here, so they have to travel. There's a lot of people that can't travel, so they don't have transportation to travel, so I think they're the most vulnerable. Getting access, getting out, and getting integrated with these services as a primary and major barrier. Questions on key informant interviews before we clip along? No? Great. So let's talk about the focus group. Thank you, Danielle. Thank you, Danny, for actually running these focus groups. She did a fantastic job running 7 focus groups throughout White Hills, all the way down to Bullhead City. And what I have on here are the 3 most commonly brought up elements of the conversations from those focus groups. So in White Hills, after that roundtable discussions, they want to see investments in transportation services. They want to see investments in more accessible internet services and nutrition services, either delivered out like a Meals on Wheels program or that education. We see transportation being a major issue in Topak and Golden Shores as well, though they're suggesting the development of rideshare programs. Nutrition pops up once again for nutrition education, recipes or services, and then information on what resources are available throughout the county. In Lake Havasu, they're really looking for a county-wide health coalition. And while this is one of the largest health coalitions in the county, we are missing some key players from these meetings. They'd like to see stigma reduction training, dovetailing back into that perceived mental health need, but that uncomfortable feeling using those services, and then activities and education for early childhood. Kingman also would like to see support for education and activities for early childhood and support for juvenile services. It'd like to see the launch of medical navigation services, which is basically a one-stop shop where you can go and get directed to what services are available and when they're ready to accept new patients or individuals. And they kind of double down on that bin into saying KRMC linked to local services. They seem to want that navigation site to be housed at the hospital. Dolan Springs brings up transportation, community engagement, and more community services. Colorado City would like to see an expansion of its recreation centers, would like to see access to specialty healthcare services, we all would, and school-based behavioral health. And Bullhead City would like to see nutrition education support, barriers to remove the costs of healthcare, insurance barrier removals, and then an enhancement of the pediatric care infrastructure in that region. And then we'll kind of close this all off talking about some of the healthcare utilization data, what we actually see here at KRMC, who's coming in for services. So who uses the healthcare system here? It's anyone typically between ages 50 and older are the vast majority of individuals making use of the healthcare services, though there still is a large population of younger people coming in. And the reasons that they come in to integrate with, there's a lot. I know this is a lot. You'll get the slides afterwards. I apologize. These are ICD-10 codes. These are diagnosis codes that our providers use whenever patients come in and are discharged from the hospital. The most common reason, about 21.8% of the visits, are for routine health maintenance. They're for signs, they're symptoms, for their abnormal clinical or laboratory findings, things along those lines. The second most common reason are what are called factors influencing health status and contact with health services. This is kind of a catch-all. So this can range from elements like having specific genetic isoforms that predispose you to the development of cancers. This also ranges to being homeless and needing a bed for the night, maybe making use of the emergency department for that. Having food instability, things like nutritional miasmus. This general catch-all of there's not a specific place to put them. They're in need of social support and social networks. And then musculoskeletal and connective tissue disorders. Yeah, absolutely.
What is health-related social needs?
Health-related social needs are very similar to social determinants of health as we're talking about them. So social determinants of health are social factors that determine your health status. If you have that as a need to improve your health, we'll refer to them as a health-related social need for that patient. Sorry for the general verbiage there. It comes into how healthcare systems can make available those resources to patients. So we can screen for health-related social needs. We can't screen for a social determinant of health. But a key informant can tell us a social determinant of health, but a patient experiences the need.
So would transportation, lack of transportation be a social need?
It absolutely is. Yep, lack of transportation, lack of food, lack of housing, lack of financial resources, the electricity going off, things like that.
Are all this data compiled from all KRFC campuses and urgent care?
Yep, absolutely. So this is our primary care, this is our urgent care, this is our emergency department, these are our inpatient units, these are our specialty clinics. That's a lot, but I want you to take away something that maybe you can see more directly for individuals in your family or what their needs might be. So we'll break it down by a little bit by age groups here. And we're going to see a recurring cast of characters. Not surprised, the most common reasons people come into the hospital are the most common reasons they come into the hospital across their age. So for young children, typically between birth to 5 years old, we most commonly see them for health-related social needs or that diverse array of, say, genetic testing for predisposing to long-term outcomes. They're coming in for respiratory diseases and they're coming in for injuries. Little kids hurt themselves fairly often. When they get to 6 to 10, we actually see respiratory disease as the primary driver why we're seeing those ages. And then we see the emergence of ear, nose, and throat infections. So otolaryngological. Apologies. Exactly. Our teens and young adults are coming in, unsurprisingly, for respiratory diseases, these factors influencing health status and musculoskeletal concerns. Just flip-flopped in a little bit of order depending on how old they are. For our actual adults, between 30 and 39 years old, it's the same things that are happening for individuals between 11 and 19 and 20 and 29. When we transition into 40 and 49 years old, we see the emergence of endocrinological concerns. So these are things like your diabetes and other endocrine dysfunction systems. For our older adults, between 59 and 69 years old, it stays relatively similar. Factors influencing health status, musculoskeletal concerns, and endocrinological concerns. The full health needs report will have this broken down a bit more than that, but that might be a little bit much. We decided that was a little bit much for this meeting here today. And then finally, for our oldest population, our senior population, 70 years or older, musculoskeletal concerns, orthopedic interventions, factors influencing their health status, and we see the emergence of those cancers start to crop up as one of the major drivers. So just in summary, we'll get rid of the graphs, we'll get rid of the charts. The community health needs assessment is based off a diverse data collection process consisting of community surveys where 3 things kind of jump to the top: weight control and joint pain. Factors issued limited access to providers and economic insecurity seem to be the main drivers that our community members are responding as major needs. Our key informants provided us 3 main key insights of where to invest in infrastructure and design, access to healthcare and education. Our community conversations gave us 3 main targets to invest into, with transportation, health navigation, and community services. And then our health perturbations can provide a reference frame for what those services can act to serve, and those be respiratory concerns, musculoskeletal concerns, and endocrinological concerns. I will then kick it back to, if there's any questions on health-related data for right now. No? Fantastic. I will kick it back to Dr. L for prioritization exercises.
So I know that Anthony just threw a lot of data at you, and it gave us a lot to think about in terms of different health areas and health needs in our community. We can't, unfortunately, we don't have the time or resources to address everything that he covered and that even wasn't covered in the community health assessment. So what we do have to do is prioritize what areas of need we should be concentrating on. And in things that we have to consider as we prioritize these needs is what were the significant health needs that were identified during that CHA process, during the data synthesis process, your own knowledge, expertise, and experience in these areas that will inform your thoughts for prioritization, and how the health needs or areas align to prioritization criteria to narrow down on what we want to concentrate on and strategize on for the next 3 to 5 years. So break out your phones again, break out your computers again, and we are going back to Menti. So the next. Oh, sorry. Do you want me to repeat it again? Okay, sorry. Okay, so the first criteria that we're going to look at is being able to rank those same issues that came up that Anthony brought up from the CHA based on the criteria of the magnitude of the issue. So if you're here in person, you are going to long press each issue and then drag it in the order that you want to rank it. And if you are online, you're just going to use your mouse and drag it to where you want to rank it. And I want you to think about the magnitude. So how many people in the community are or will be impacted? How does the identified need impact the health, quality of life, and the conditions in which we live, work, play, and age? Has the need worsened over time? And are there differences in how the issue is experienced between our many diverse communities in Mohave County? And it should be open. I had to open it while I was talking, so if it didn't work, just refresh it. It's tracking it. You can see it moving. Give you guys a little bit longer on this one because I know that ranking it takes a little bit longer. And please take cookies and pastries before you.
Weight control.
Didn't I order fruit? I thought I did order fruit.
I don't know. We got what we got.
And the funny thing is, at Rotary the other day, Susan brought in watermelon. Now, Auntie Ann usually brings cookies, and they disappear like that, the watermelon.
Usually when it's summer, like I just really start craving watermelon.
It was just funny. It was like somebody eat.
One thing, I think we're nested in a little of these responses. Healthcare access and quality, health navigation and transportation feel like they commingle, right? They all commingle.
I think it's also like how you define health navigation, right? Is it just like how you physically get there, or is it getting through the system of like, well, now I have to get into primary care. Oh wait, the primary care is sending me to a specialist. All right, well how? Oh wait, now I have to go back to primary care, or I have to go to another specialist. So being able to navigate kind of that.
Insurance system.
Yeah, and insurance too.
Even worse as you get older with, thank goodness I don't have to deal with Medicare yet.
Yes.
I find that
But I
when
hear
you when you go to the doctor, if you have a PPO and you don't need a referral, a lot of the people working in these doctors' offices don't understand that factor. So they make you go through the referral process instead of just giving you the information to a specialist that you can call yourself.
Yeah.
So it's educating the employees as well on the process of insurance and how insurance companies work. Because I find that here to be a huge problem.
Mhm. Yeah, insurance is very complicated, and also just having our authorization and referrals department to try to make sure that everything is all ready for every person's appointment by the time they get there, right? But things could expire right, like maybe the day before, and they checked it 2 days before. So then, how far in advance can you prepare for a patient to come in? It starts getting very muddled.
I agree with Penny on that. All of the office staff don't seem really up to speed on the insurance, exactly what's going on. I think maybe they just, because there's often a quick turnover of office staff, then I think, or I wonder if they get a good, working period, a training, if you want to call it.
Yeah.
Because that is an issue. I mean, speaking just personally now as well, not speaking as just a resident, it's a big issue, yeah.
We think about it, it's a challenge through kind of every step on the pipeline. From office staff, just learning the intricacies of moving a single patient through insurance, even to how we affiliate and contract with our payers to pay for that services, are goalposts that move on an annual basis. What needs to be submitted, what they're going to be willing to pay for, how that works. So a lot of that muddiness is being tackled right now on the state level and federal level with, I think everybody here is well aware of the different lawsuits that have been moving through between payers and providers and the different legislation that's moving to try and make that a simpler process with the end goal of making it easier for the patient to get these services paid for that they need.
Insurance companies are, I think, one of the major issues because why make it easy when you can make it complicated, it seems.
Yeah, I hear that a lot. Okay, getting back to this. So ranking our different health needs and priorities, it seems like what has floated to the top is healthcare access and quality. Did anyone put this as their number one? Yes? Well, do you want to elaborate on why you did?
Oh, yeah. So as you know, it's hard for us to get access to quality healthcare here in Mohave County. As somebody else mentioned earlier, we're traveling to Vegas, to Phoenix, to Flagstaff. So for us to have that quality healthcare here and have access to it, I believe it would be so much better for our community, because I have heard from a lot of people in the community, they would rather not see a doctor than to have to go to Flagstaff, Phoenix, Vegas. They would rather not do it at all. So that is one of the barriers here, obviously. For me, I feel it's a barrier.
Yeah, and that hits on the preventative care issue, right?
Yes.
So if they're not doing an annual wellness visit, then they're really not coming in until it's at a later stage.
Yes, I agree. Yes.
Bob?
Well, I think it's everybody's concern. I know it is a priority to improve access and quality of care. And I just think we need to always keep that as a top priority for our focus as a community.
Absolutely. Who added in economic insecurity, sorry, I can't speak today, as one of their top ones? Anthony?
So I added economic insecurity because this is the umbrella that enables our residents to travel for healthcare if they need it, to make use of it here. Insurance can be a challenge to go through, but if you can pay out of pocket, you have access, and you have rapid access because you're not dealing with these burdens of legislation and processes that you have to go through in the same way. I think it trickles down into which community services you are able to get into. We saw that with our dental care. 20% of people can't use the dentist because they can't afford it. Well, economic insecurity is the main driver for not being able to have that. Transportation, also the main driver with economic insecurity. So I think that if there's a way that we can elevate the floor for the financial resources that our population has at their disposal, they may make use of them to improve their own health.
Danny?
I agree with everything that Anthony said. I think too, there's a systems level change that needs to be done with the constant gouging, price gouging on all levels. When it's very expensive to get healthcare, it's very expensive to eat healthy, and even if you have insurance. So you saw in like you guys mentioned in the responses, there's a lot of people with education and jobs that are responding. And a lot of us are still having difficulty meeting our own personal needs because it costs too much. So economic insecurity is a huge driving force.
Yes, Marcia.
In that aspect, people that they're homeless, and so there's not a definite. I'm not saying that because you're homeless you can't get help, but unfortunately that does happen. If you're homeless, you don't have access to home health. If you're homeless, it's difficult to provide hospice, and a lot of the times it doesn't happen. I'm working with a lady now who is a double amputee, and she couldn't get her legs because she was homeless. So hopefully she'll get them this week.
That would be amazing.
So it does affect, because if you can't get the access to what you need, then your needs are going to continue to grow, and you're just going to get worse, and it's become a bigger problem. So unless we address those needs in the beginning, it just continues to grow and becomes worse.
Yes, absolutely. Those needs can start to snowball if we can't start to address them in an early stage, right? Okay. The next thing is community services. Who ranked community services pretty highly? Number 3 is community services. Did anyone rank community services at a high point? Yes?
Me?
Yes.
Oh, sorry. Yeah, so I definitely think we do. To be honest, I'll be honest with you, and I know this came up at the beginning of our meeting too. I think we have a lot of community service, but I think it's hard for people to know about it, or for us to really expand on that, right? Like, we're trying to get the data, and you guys did an awesome job with this data. We're trying to get the data to be like, yes, we are seeing homelessness. Yes, we are seeing it that are basic. But it's kind of hard when those people can't get to the community service, or other people don't know about the community service. So then those groups of people, they kind of like whittle away because they're not getting connected to the people that they need, and the people in the service are getting connected to them.
Yeah, that's a very common thing that I've been hearing, that there are many services that exist, but a lot of people don't know about it. So how do we connect all those people to the different resources? How do we make everybody aware of each other, right? And then how do we share that out to people who might not be able to physically come in, who don't have the internet, who might not really want to answer a phone, or have other difficulties with accessing these resources, right? So how can we go out and we can bring that to them? Danny's done an excellent job leading the mobile health unit and bringing services out to different areas in those rural communities. So I think that's an excellent start. Also being able to have all these different community fairs that go out to different locations as well. Does anyone else say community services?
I would say 4th and 5th will help drive community getting that. Education and health navigation, having a hub would help people know about the community services. It's actually Penny with the MHU, but.
Penny leads the mobile health unit.
Sorry, Marcia?
I was just saying community services as well. It's the organizations partnering and working together can achieve so much more. Yeah. You know, one organization may be able to do this part to help meet the needs, but they can't do this part over here. Another organization may be able to help with that. But people being sent from one place to another to try and figure it out for themselves, as someone who has helped people to try and connect, sometimes it can be overwhelming even for someone who knows how to access those resources, and to expect people to navigate that on their own when they're going through some sort of trauma can be difficult.
Yes, I consider myself pretty savvy for the healthcare system, and when I get hurt, I'm very overwhelmed, even knowing the people that I know and all the resources that I know. Yes.
How do we reach these people that live off the grid? And I'm not talking about just in like the small communities like me doing that, but there's people that live completely out in the desert. They don't have Facebook and internet, what we sort of use. How do you reach these people? I mean, we talked to a gentleman at one place. He comes to see us because he does not see anybody for 2-3 weeks on a thing. He has no communication. I'm sure he has a phone if he has enough money to pay it. And where he lives, the signal, where we go with the internet, sometimes his signal's not good. And then he has to actually run down the road to get a signal. I mean, it's really hard. If you just drive, for example, to Las Vegas, and you look at all these little trailers and little single wides out on the hills, how do we reach these people and get them the information that that there are facilities to help them?
I think one of the important things that we need to consider is that it's engaging with health and wellness is a two-part street. And as organizations and as community leaders, we need to make that access easy, but never force someone into a service they don't want to receive. So open the doors, welcome them in, educate them toward the availability, but they have to walk through that door when they're ready to walk through that door. So if they choose to live off grid, not to interface, the resources are available. We'd love to take it to them, but it's not our place to take it to them. Just welcome them in. I think that's kind of my perspective moving. When typically we speak to like individuals who are residing as like sovereign citizens and whatnot, they can make use of the services, but often they may not want us knocking on their door saying, here's your COVID shot, right?
Also, it's a safety issue because a lot of them have firearms, and if you show up randomly at their home, you're putting your safety at risk. So that's the other.
I do want to say, just that's part of this whole process, is that we are working on ensuring that we are getting this information out to people. And in those rural areas where I did the focus groups, we've already identified how can they help themselves and their neighbors to get this information. So during the community health improvement plan, that is something that we'll be tackling.
I know a lot of those people choose to live in those rural areas, and some of them choose at a younger age, but when age comes into play and chronic disease comes into play, and all of a sudden they realize they're alone and they have no access to healthcare needs, they have no neighbors, and then they go to the doctor, and or they get put into the hospital. Then they realize, alone, I need these services now. I had a couple who reached out to me from Littlefield, the Littlefield area, above Mesquite, and they said, well, we moved out here because of the housing, and then now we're out in this community, we're 80 years old, we don't have any services for meals, home delivered meals. How can we get home delivered meals out here? So they don't realize at a younger age what they're going to need when they get older. So they're really choosing these services sometimes in the rural communities, even though they chose to live in them at an earlier age. So
Yeah, and I think that this question kind of gets at to the magnitude of the need that various communities have, like around Mohave County, right? So, sorry, I think I'm like losing my voice. So, does anyone else want to add anything to magnitude of the issue before we move on to the next criteria? No? Okay. Then the next criteria that we're going to address using the same issues is you are going to be ranking these issues based on ability to impact. So can actionable and measurable goals be defined to address the health need? Are those goals achievable in a reasonable time frame? Does the Live Well Mohave initiative and its partners have the expertise and the resources to address these various identified health needs? And are there organizations that are already addressing the issue? And once again, you're going to use Menti and rank these issues. Different things floating to the top.
It's fighting between three different things. Yep.
Seems like the top three are still the top three. They're moving like.
There's no love for weight control and joint pain.
I have difficulty going to the gym myself.
So it looks like the top three have kind of stabilized. So who ranked health navigation as one of their top issues? Linda, in the back.
Yeah, so I put that in there because, there were comments about us having, there were comments about us, having these resources and having healthcare. Well, oftentimes it is confusing. And so it could be health navigation for different type of methods, be it a person, a program, software, somewhere that can really make it digestible and a little bit simpler for a person in our community to know what steps are to have done next. It can also be a part of the simplifying of the steps within healthcare. Like there was a mention about the referrals. I know that we've been working on trying to simplify that. How does your even PCP know that when a referral has been placed, where it's at, and so that everyone's in the loop? Because it's not just like health navigation from the patient side, it's even like health navigation on the provider side, the healthcare side. So we all understand how to move someone forward in the process. And you yourself or your provider is not frustrated where we're not on the same page. So I think that's a little more like if we wanted to take action today or tomorrow, that's potentially a step that we could do sooner than some of the other items.
Yes.
I looked at that. I had it my last one because we don't have the ability to impact it. So I looked at it, same thing, but from a different angle. So like community health workers, navigator, there are positions for that, right? But we need it. Everything I keep hearing is there's a disconnect between those who need it and the services that are there. That's the person who can do it. There aren't jobs for that.
Yeah.
And so for me, I ranked it as lowest because we don't have the ability to have an impact, not at this moment, right? Because those positions aren't there. So, like, I work at Mohave Community College. We have a community health worker program in Havasu because someone got a grant, United Way, to do that. We want to expand, but we're not going to be able to have expand it to the other places because there aren't actually jobs for these people to go to. So why have the program to educate them, right? People won't come in because they're like, what kind of a job am I going to get?
So they're worried about that stability afterwards, right?
Yeah, exactly.
Like, what is going to be the avenue to job placement?
Yes. But that's all I keep hearing here is there's that disconnect and there's that need. Well, where are those positions? Why don't we have those?
So if those positions or opening those positions, would there be a workforce ready to go and fill those positions if they were opened?
Yeah. And so we need to work together, collaborate on that to make that happen. That's why I'm here.
I'm looking for a navigator, so that's actually works really well. Yeah. We should talk.
Absolutely.
Next up, sorry, I can't see this, is healthcare access and quality. Who ranked that one highly? Yes, in the front. Yes.
Oh, okay. Oh, I still feel that the healthcare access and quality is huge. It is so important here. As I've seen a lot of the community within Kingman and Mohave having such difficulties getting healthcare that I feel it should be up there on the list.
So I just want to say, I think a lot of these things we don't think outside the box, so to speak. Like getting providers here, is there a tax break for housing? But do we have housing? Like, so there's so many different components. Are we looking at other ways to figure out how to get them? That's kind of low on my point because we here in this room cannot really impact that one that much. So.
Yeah, as Anthony mentioned as one key informant, that if we want to get good people, not just health care providers here, what is there in the community for them? Are there schools for their kids? Is there a place for their spouse? Is there stuff for them to do, right? You want to consider each of your potential candidates as a whole and meet those needs as well.
If I was a doctor, that's what I'd be looking at when I came into a community, or if my husband was, I would be looking at that. What is there to offer here in Kingman, as far as shopping, restaurants, activities for the kids, things to do. That is
quality of food.
Yes, absolutely. Yeah.
Education is a big one.
Yep, education is huge. Did you rank it?
Yeah, I do. I think education, and I think it goes in with that economic insecurities. Because what I'm finding is I help a lot of the seniors on their billing issues at the hospital. If you don't code those bills correctly, they don't get paid. So the people are paying bills that their insurance companies should be paying because they're not being coded properly. So I used to be a coder for 12 years. So I work with people and talk to them about, you give me all the things that you have wrong with you. And if they're not on that bill, then it's not getting paid. And that's what I did. I did quality assurance for billing for a hospital for 12 years. And I brought in $1 million almost a month that would normally be lost because of inaccurate coding. Because either the doctors put the codes on and the person entered it in the system does not put all the codes in, or the doctor doesn't necessarily put the codes that match each one of the tests, because each test will cover certain codes. And I think that's a huge thing with your billing department and KRMC. And that's a big issue with the community because I've dealt with it personally. And I've come down here and, you know, if you code it, my insurance will pay it. So I code mine myself. I mean, I put codes on my bills because I know what's wrong with me.
You put your codes on your own bills? I wish I was familiar enough.
Hand on Teams.
Amy West, we would love to hear from you.
Hi. I put education in there, but I look at it very differently what the other person just said. In my mind, I look at education as breaking some of those generational issues that we have, which in turn will help solve some of these things that we're seeing here as issues. So I look at education as in making sure that our students, making sure that maybe a high school student is able to get engaged in a community college program in a partnership that we have with business and industry, someplace where they can get the training and skills necessary to get a high skill, high wage job that's going to allow them to live a sustainable lifestyle. When we do that, we then allow them to have the ability to probably have healthcare access to some of the things, the economic insecurity decreases. I look at education as taking adults that perhaps have never been engaged in any sort of skill training and trying to get them into some sort of skill training so that we can change their life situation that in turn will improve these issues that they're having. So I don't look at education as in educating them about the healthcare system. I look at education as in training people so that they're not so reliant on some of these issues and changing some of the generational issues we have with low educational attainment, which then hopefully improves our community overall.
Amy, I think you said it wonderfully as education taken to skills development and an entryway into gainful employment.
I also think, I feel like in my voting, I've been beating the drum about education as well, because I can't help but think about all the ways in which it impacts one's health and wellness. It's not just knowing, for example, we have high rates of smoking. It's not just knowing that smoking is bad for you. That's not a secret to anybody anymore. It's also understanding, having some savvy to understand, okay, I have this problem. How can I take steps toward trying to kick this habit? And for those who are maybe generationally disenfranchised, there's a huge barrier there in being able to get them on the inside.
Yeah, and also not being able to change environments, right? So if you have a spouse that also smokes, or if you have a parent that smokes, well, if I'm a minor, I can't leave that house, right? So, or if I'm not well off, I also can't leave that environment. So, that's a very good point. Okay, sorry. We've dallied too long on this, sorry guys. Next we have CHIP planning and next steps. So what is gonna happen next? We have kicked off the CHIP process today. Next, we will be forming CHIP groups in various locations around Mohave County so that each individual community can devise a CHIP plan that is best for that community, instead of trying to have one overarching one that tries to cram everybody's needs and wants into one plan. So we are going to need community members like yourselves, like your friends, your family, other people that you work with, to join these CHIP groups, to join these action teams, to review recommendations, to review the data, and come up with that specific areas, goals, objectives, and strategies for addressing those specific priorities. And of course, the CHIP teams will all be supported by staff from our partner organizations. So as the CHIP work groups are devising a strategy, so you want them to kind of think about, what would it look like if this happened? What would it look like if we brought this? What if it looked like if we did this? To identify what are the existing assets and resources that are available for people in that community. As Danny brought up in the various focus groups, these communities do have resources already. They have ideas, so let's use that as a jumping off point, right? We want to keep these strategies smart, so specific, measurable, achievable, relevant, and time-bound, especially for the people living in those communities. And let's also document the process, not only for that specific work group, but also for future CHIP and CHA cycles. So what happens next? Please sign up for a work group. If you would like to be a community champion, please sign up for a leadership role. There are sign-up sheets on the blue clipboards at the front. Each of the work groups will be scheduled around the time, day, and location based on the needs of the work group. Do you need me to leave this up more? Okay, so today is the CHIP kickoff. We have upcoming in-person CHIP work groups that are tentatively going to be located in White House, Topeka, Lake Havasu City, Kingman, Dolan Springs, Colorado City, and Bullhead City. If you're interested in leading or participating in one of these work groups, please, I highly encourage you to sign up. We're also looking for community champions. Please talk to Danny, sitting right here in the center, or you can email her at lagandi@mohave.gov. And then I want to close off with a little bit of a thought exercise. So think about, as we're moving forward through the CHIP process, what am I bringing to the group? What could we do together? What should we do together? And if we imagine that Mohave County is recognized nationally for successfully addressing these priority health areas, what is that going to look like in our future? So I would like to thank everyone who has participated either today or online, whoever filled out a survey, did an interview, came to a focus group, and to everyone who has been involved so far. Does anyone have any questions?
Hit the slide file.
The slide file will be sent to everyone who registered, and also to you, following the meeting. All right. Yes?
That there are signups right outside for the group.
They are right in the front of the room.
Is there going to be online anywhere other than, or do they just email?
So as far as the focus groups that I facilitated, I've already reached out to everybody that was in attendance, but I'm also doing online calls for anybody that wasn't a part of it but would like to be a part of it. So I am tackling it both that, and we have our mobile health unit who has some messaging when they go out to the rural areas as well.
Thank you.
All right. Any questions from Zoom land or Teams land? No? All right. Any other final questions? No? Okay. Well, thank you everyone for attending today. Please take snacks if you're in this room.
We'll send it to you, Dan.
All right. Thank you.